What if the health tests you think are protecting you are actually putting you at risk? This might sound crazy, but it's a reality many doctors are starting to acknowledge. After age 70, certain medical screenings can cause more harm than good. Today, we're going to reveal 5 common tests that many seniors should avoid and explain why even experienced doctors often refuse these screenings for themselves. If you care about your health but want to avoid being overtreated or overwhelmed by unnecessary medical procedures, this video is for you. Make sure to like this video and subscribe with notifications on so you don't miss important health information that could change your life. Test 1. Routine cardiac stress tests. Your heart is precious, and wanting to protect it makes complete sense. But here's something most people don't know. After age 70, routine cardiac stress tests can be more dangerous than helpful, especially if you're not experiencing any symptoms. These treadmill tests often give false alarms in older adults. As we age, our bodies naturally change. Our arteries become slightly stiffer, blood pressure varies more, and heart rhythms shift. These are normal aging changes, not disease. But the stress test can't tell the difference. When the test shows something abnormal, it sets off a chain reaction of fear and more testing. You might end up getting angiograms, catheterizations, or even stent placements. For seniors, these procedures carry serious risks, including bleeding, kidney damage, and dangerous blood pressure drops. Let me share a real example. George, a 74-year-old man, felt perfectly fine. No chest pain, no breathing problems, no fatigue. But his doctor ordered a stress test just to be safe. The results looked concerning, leading to an angioplasty procedure. Within a month, George developed a severe infection, spent time in intensive care, and his quality of life never fully recovered. Leading heart specialists now recommend against routine stress tests in older adults without symptoms. If you're not having chest pain, shortness of breath, or unusual fatigue, the test often provides no benefit but significant potential harm. Instead of chasing every possible problem, focus on what truly supports your heart: daily walks, healthy meals, staying connected with others, and managing stress. These simple actions do more for your heart health than any machine or test designed for younger people. Test 2. Overuse of colonoscopies. Colon cancer is scary because it often has no warning signs. That's why colonoscopies became so popular as a prevention tool. But after age 70, especially if you've had clean screenings before, these procedures can become more risky than beneficial. The colonoscopy process is tough on older bodies. The bowel preparation alone can cause dangerous dehydration and mess with your electrolytes. The sedation required for the procedure affects older adults differently. Your liver processes medication slower, and your brain becomes more sensitive to sedatives. This can lead to lasting confusion, memory problems, and brain fog that can persist for weeks or months. Here's the key point. Colonoscopies look for slow-growing polyps that might become cancerous over 10 to 15 years. If you're already in your 70s or 80s and have had previous clean screenings, the odds of those polyps causing problems in your remaining years are extremely low. Meanwhile, the risks of complications like bleeding, perforation, and bad reactions to medications increase significantly with age. Eileen, a 78-year-old retired teacher, had clean colonoscopies at 68 and 73. At 78, her doctor suggested another one, just to be safe. During the procedure, her colon was accidentally damaged, requiring emergency surgery. She spent nearly a month in the hospital and never regained her previous energy and independence. Many medical associations now say that for older adults with previous clean screenings, the potential benefit becomes very small while the chance of complications grows significantly. Pay attention to actual symptoms like unexplained weight loss, persistent stomach pain, or blood in your stool. In those cases, investigation is absolutely necessary. But routine screening without symptoms may not only be unnecessary, it may be dangerous. Test 3. Full body scans. Full body scans sound like smart prevention, having a machine look through your entire body to catch problems early. But for people over 70, these scans often create more problems than they solve. These powerful CT scans and MRIs pick up everything, including harmless abnormalities that would never affect your health. These incidental findings can become mental time bombs. A small spot here, a shadow there, and suddenly you're trapped in a cycle of follow-up appointments, biopsies, and specialists, all chasing something that might never have mattered. Why is this worse after 70? Because older bodies don't bounce back the same way. A biopsy that would have been simple at 45 can now lead to a collapsed lung, infection, or weeks of recovery. Even lying still for an MRI can be exhausting or painful for aging joints. Betty, a vibrant 78-year-old woman, had no health complaints. She walked daily and felt great. At a health fair, she got a discounted full-body scan. They found a tiny spot on her kidney that hadn't caused any problems and likely never would. But the word lesion created panic. Within a month, she was in surgery. The result? Months of recovery, lower energy, and lingering complications that never went away. All for something that might have remained harmless forever. This is called overdiagnosis medically, but emotionally it's unnecessary fear. Full body scans are rarely covered by insurance. So many seniors pay out of pocket thinking they're buying peace of mind. Instead, they're buying a ticket into a system that may never stop testing. At this stage of life, trust your body more. Listen to how you feel, not just what machines say. Not every shadow on a screen deserves your energy or fear. If you're finding this information valuable, please comment helpful below to let me know you're here. Your support helps us continue creating content that truly matters for your health. Test 4. Routine mammograms after 75. Breast cancer screening has saved many lives. But after age 75, routine mammograms can become more harmful than helpful, especially for women without symptoms or high risk factors. The problem with mammograms in older women is that they often find slow-growing cancers that might never cause problems during a woman's remaining years. These cancers can take 10 to 20 years to become dangerous, and for a woman in her late 70s or 80s, that timeline may never become relevant. But finding these slow-growing cancers leads to treatments that can be harsh on older bodies. Surgery, radiation, and chemotherapy become more difficult to tolerate as we age. The side effects can steal months or years of quality life, all to treat something that might never have caused harm. Additionally, mammograms in older women produce more false positives. Dense breast tissue, cysts, and other age-related changes can look suspicious on the scan, leading to unnecessary biopsies and anxiety. The stress of waiting for results, undergoing additional tests, and worrying about cancer can seriously impact mental health and quality of life. Martha, an 81-year-old grandmother, had a routine mammogram that showed a small suspicious area. The biopsy revealed a slow-growing cancer that her doctor said might never have caused problems. But the word cancer was terrifying. She underwent surgery and radiation treatment that left her weak and exhausted for months. Looking back, she wonders if the treatment was worth the toll it took on her final years. Many cancer specialists now recommend that women over 75 focus on being aware of changes in their breasts rather than routine screening. If you notice a new lump, skin changes, or discharge, those warrant investigation. But automatic yearly mammograms may not be the best choice for every older woman. Test 5. Routine bone density scans. Osteoporosis is a real concern as we age, but routine bone density scans after 70 can lead to overtreatment that creates new problems. These DEXA scans measure bone thickness, but they don't tell the whole story about fracture risk. The issue is that bone density naturally decreases with age, and the scan results often lead to automatic prescriptions for osteoporosis medications. These drugs can have serious side effects in older adults, including jaw bone death, unusual fractures, and digestive problems. For many seniors, the side effects of the medications can be worse than the condition they're meant to prevent. Furthermore, bone density alone doesn't predict who will fall and break bones. Your balance, muscle strength, vision, and home safety are much more important factors in preventing fractures. A person with slightly low bone density who exercises regularly and has good balance may be at much lower risk than someone with normal bone density who is inactive and unsteady. Robert, a 73-year-old man, had a bone density scan that showed some thinning. His doctor immediately prescribed a bisphosphonate medication. Within months, Robert developed severe acid reflux and jaw pain. The medication made him feel sick and weak, actually increasing his fall risk. When he stopped the medication and focused on balance exercises and strength training instead, he felt much better and remained fracture-free. Instead of relying on scans and medications, focus on what truly prevents fractures: staying active, doing balance exercises, ensuring good lighting in your home, and maintaining muscle strength. These approaches are safer and more effective than most medications. Growing older doesn't mean you need more medical tests. Sometimes the wisest choice is doing less, not out of neglect, but out of deep understanding of your body and your goals. Healthcare after 70 should be about conversations, not automatic protocols. It should focus on what matters to you, how you want to live, and what risks you're truly willing to take. Following routines designed for younger bodies can rob you of energy, peace of mind, and quality time. Saying no to certain tests doesn't mean ignoring your health. It means being thoughtful about weighing benefits against burdens. It means recognizing that not every test leads to better health. Sometimes they lead to unnecessary worry and treatment. Take ownership of your health decisions. Ask your doctor whether a test is likely to change your treatment or just create more paperwork. Think about your time, energy, and comfort. At this age, those are precious resources. You've earned the right to live on your terms, not fearfully, but thoughtfully, not overloaded with procedures, but empowered with knowledge, and not constantly preparing for sickness, but actively creating a life of meaning and joy. Thank you for watching. Please leave a comment below sharing one thing you learned today and how you plan to use it. Your thoughts motivate us to keep creating helpful content. If you found this video valuable, please like, subscribe, and share it with someone who might benefit. We'll see you in the next video.